I don't think I've met a single person who said I don't have hair fall. So I don't want to be killed by people, but uh, any oil is a good conditioner. It's not going to actually cause more hair growth, right? So you can do a chumpy to feel relaxed, and the massage and all, it really feels nice, and you can, sort of de-stress maybe, but it doesn't really get into the scalp and do anything to the hair roots. Actually, your skin is what you eat. You have to remember that. Sometimes people don't realize and they put like layers and layers of stuff on their skin, like face wash ho gaya, fir essence, fir serum, then cream, then sunscreen, then this, then that. So that itself can clog your pores, so keep it a basic minimum.
Hello guys, hello and welcome back to Pinkvilla. I'm Priyanka Modi from the fashion and beauty team, and we're here to discuss everything about skincare and hair care. So just a few hours ago, we did a poll on our Pinkvilla fashion Instagram, and we did get a bunch of questions, and believe me, there are a lot. So today we're with Dr. Jaishree Sharad, who is a celebrity dermatologist, and she's literally on our back and call whenever we need her. So hi Jaishree, welcome to Pinkvilla.
Hi Priyanka, thank you so much for having me.
So we'll start by the questions we've received, and one of the most requested problem ka solution that we want is what to do about hair fall, and why do we keep facing it again and again.
So one of the most common reasons now is, of course, stress, and the second is nutrition, and the third is water. So everybody's going through this turmoil, and some are stressed, some are not, but there are changes happening in the environment and in the body which are taking a toll on the hair cycle, which is why people are experiencing this hair fall. Also, during the lockdown, people did a lot of binge eating, or people were starving. So either this or that. And either ways, it has affected the hair. So now it's all, I don't think I've met a single person who said I don't have hair fall. So first of all, start eating right, increase your proteins, make sure you have like 60 to 70 grams of proteins, lots of fruits, vegetables, take supplements of iron, vitamin D3. Everybody's been indoors, so I'm sure vitamin D3 has dropped. So take vitamin D3, vitamin B12 supplements, chromium, selenium, vitamin A, B, C, D, E. Now, apart from this, avoid heat styling too much, because the hair are a little brittle. And don't be lazy. Make sure you shampoo and wash your hair at least alternate days. And those of you who have, hypothyroid or polycystic ovaries need to consult with an endocrinologist. And most importantly, de-stress, meditate, do yoga, pranayam, whatever it takes to just de-stress. And finally, if you have dandruff, then you can apply a little bit of aloe vera with yogurt. Just take that, massage it onto your scalp, leave it for 10 minutes and rinse it off. So that's a good home remedy for dandruff, because if you have a lot of dandruff also, you'll have like a little bit of hair fall.
Okay, so apart from that, do coconut oils like these chumpies really help?
So I don't want to be killed by people, but any oil is a good conditioner. It's not going to actually cause more hair growth, right? So you can do a chumpy to feel relaxed, and that massage and all, it really feels nice, and you can sort of de-stress maybe, but it doesn't really get into the scalp and do anything to the hair roots. However, your shaft, this is called the hair shaft, so when you apply oil in the shaft, it acts like a very good conditioner. So you can apply it, leave it on for about 2 hours, and then you can shampoo it off, rinse it off.
So is that like a home remedy for frizzy hair instead of hair growth?
Yes, definitely. Definitely.
So that solves.
In fact, what happens? Like if you have if your hair are really frizzy, then even after shampoo, you can just take just few drops of oil. It could be almond oil or coconut oil, whatever. Like not so much, but just about 4 or 5 drops, and just rub it on the length of your hair. That also reduces the frizz. It doesn't look oily and sticky. It doesn't look chip-chipa.
Okay, and now our next question goes to like the skincare part of it. A lot of people are asking us about patchy skin, like pigmentation, acne scars, and this tan that never goes. So do you have a home remedy for it, or can it be dealt through home remedies?
So it depends on the level of hyperpigmentation. I mean, if it's just a tan, then yes, you can use, if you have normal skin or dry skin, then you can take yogurt, that's dahi, and you can add a little pinch of turmeric to it and make a paste out of it. You can even take cream, malai. If you have very dry skin, you can take malai, add turmeric. If you have normal skin, then dahi and turmeric. Make a paste, apply it on the face, and leave it on for about 10 minutes and rinse it off. So if you do that gradually, the tan goes off. But if you have oily or acne prone skin, you can't apply yogurt or cream. In such cases, what you can do is you can take rice, raw rice, and make a powder out of it, add some honey and turmeric, and then apply it. So raw rice also has skin lightening properties, so that also will take off the tan. But if it is more than tan, if it's marks which have happened due to acne scars, or if it's hyperpigmentation, then home remedies don't really help. So you will need to consult with a dermatologist, and you will need to use a good sunscreen even when you're indoors. So look for an SPF of 30 and a PA triple plus, so UVA and UVB protection, as well as protection from UV light. That's your laptop blue light, that's very important. And then finally, you can use some nice creams which have kojic acid, arbutin, licorice, uh, lots of these skin lightening creams are available. I'm not for skin lightening, but if you have a tan or if you have hyperpigmentation, you can use these creams. However, make sure you see that you do not use a steroid based cream. So your skin lightening creams should not have steroids in them.
Okay, I think that helps a lot.
And one very important thing, have a lot of vitamin C. So 1000 milligrams of vitamin C as a supplement, 500 milligrams of glutathione as a supplement, and berries, lime, lemon, oranges, all that.
So I think food makes a lot of difference in anything skincare.
Absolutely, your skin is what you eat. You have to remember that.
Okay, so our next question is for acne prone skin. I think a lot of people are dealing with it, and a bunch of questions were about why do I keep getting pimples again and again? And if I have acne, how do I control it?
So again, if it's a guy, of course, you have every acne is about lifestyle, first of all. Okay, so if whenever there are hormonal changes in the body, either during puberty or just before menopause, or even when you're in your 30s, or if someone has polycystic ovaries, like if females have polycystic ovaries, you can develop acne. The second reason is when you're putting any kind of oily product on your face or your oil or your scalp, the skin can get clogged and you can develop acne. So you have to figure out and use less products on your skin. Do not use oil. Do not, your makeup should not be cakey, and it should not be clogging your pores. Sometimes people don't realize, and they put like layers and layers of stuff on their skin, like face wash ho gaya, fir essence, fir serum, then cream, then sunscreen, then this, then that. So that itself can clog your pores. So keep it a basic minimum, and use a salicylic acid based face wash at least once a day, because salicylic acid is lipid soluble. It unclogs the pores. So at least once a day, because if you overdo, then it tends to dry the skin. So that is important. And your moisturizer should be water based. Your sunscreen should be water based, and those are easily available nowadays. And then at night, if you have these pus filled acne, then you can use a clindamycin based gel. And if you have just blackheads, whiteheads, you can use adapalene or 2.5% benzoyl peroxide. But I'd say just consult a dermatologist first. And most importantly, again, Priyanka will laugh, but most importantly, you have to stop having sugar, dairy, and maida in your diet, because these will increase the insulin-like growth factor in your body. It's a kind of a hormone, which will again, send signals to your oil glands to produce more oil, and then you get acne again. So it's again coming back to food and stress and lifestyle.
Okay, so I think that also helps a lot. I have not been somebody who's had acne, touch it, but I have seen a lot of people dealing with it. So it's always different for every person. So I think this really does help a lot. Now moving on to oily skin, I've done a bit of my research and I've known that acne is also because of like the excess sebum production. So do you does like how do you control oily skin if you have such, apart from like using like these upar se creams and all of that?
So, if you really have oily skin, it's because of the sebaceous glands. So, if you have like more number of sebaceous glands or oil glands concentrated, you'll develop more oil. But if you have a hormonal imbalance or if you have polycystic ovaries, then also your glands will secrete more oil, so you will have oily skin. Now, you can't do anything internally to reduce the oil, except for the fact that, again, it comes back to the same thing as no sugar, no dairy, and no stress. So that will send indirect signals to the brain and reduce your oil secretion, number one. We do give isotretinoin in cases of severe oil secretion. We do give isotretinoin, which is nothing but vitamin A. It's a large dose of vitamin A. So we give that to reduce the oil sometimes when it's needed. But it's a prescription drug, so you can't just go and buy the drug. And retinols help. So retinol is also something that you can apply maybe twice in a week, on your skin and leave it overnight. But don't overdo it, because it can cause dryness and flaking. Also, isotretinoin and retinol are not safe if you're feeding or if you are planning to conceive or if you're pregnant. So these things you have to keep in mind. So guys, for guys, it's very easy. They don't have to bother. They can just go and use these things. And yeah, and then of course glycolic acid, lactic acid, all these alpha hydroxy or beta hydroxy serums are easily available. So if you regularly use them, you'll cause a chemical exfoliation and reduce the oils.
So right now, all these facial oils and serums and all, I don't know if it's a trend or a fad, but I really want to know, do they really work?
Yes, they do. But unfortunately, for people who have acne prone skin or very oily skin, it's a complete no. So if you have normal skin or dry skin, then you can use serums and you can use, all these oils that are there. Even for oily skin, there are some specific serums, but you shouldn't be applying oils. Although they do say that some essential oils are safe for oily skin, but they will still clog the pores and they'll still give you more acne or those tiny, tiny whiteheads.
Okay.
But otherwise, they work because they are really power packed. Serums are basically power packed higher concentrations of whatever ingredient they have. For example, if it's hyaluronic acid or, what is that, the vitamin C, which is so popular, it's really like a concentrated version of the ingredient. So it does work.
So lastly, our next question is not from the readers, but somebody from like our team. Most of us, and I think you will also agree, have a very busy schedule apart from the quarantine. So what is that this one skincare and hair care routine or like tips you'd like to suggest us?
I think you can keep it very simple in the morning by, just doing a cleansing and then apply a moisturizer and a sunscreen. So keep it as simple as that. And these days, because everybody's wearing a mask, so use a gel-based moisturizer, like any of these water or gel-based. So many of them are there. And then you can wear your mask. So that way your skin is getting protected. Otherwise, you develop those mask acne or folliculitis or rashes. And then at bedtime, don't forget to clean your face again. And then you can use a serum. So if you have dry skin, use hyaluronic acid based serum. If you have hyperpigmentation or blotchy skin, uneven skin tone, use a vitamin C serum. If you have a lot of open pores or fine lines, use a retinol based serum. And finally, of course, if you have oily skin also, you can use a retinol based serum or a salicylic acid based serum. So to keep it very simple, you can just do this, and don't forget your under eye. So any cream which has vitamin C or vitamin K in it, you just dab under the eye at bedtime. So this much has to be done, more than enough, and eat right.
And for hair?
For hair, I think the best thing is to have enough of proteins, and do not, indulge in a lot of hair blow drying and ironing and, all that every day. I see people doing that a lot because of these Zoom meetings and all that, and you keep looking at yourself, so oh my god, the hair is looking frizzy, oh my god. So, but you have to learn to stay away from too much of heat styling, and just increase your proteins, most important. And the kind of combs that you use, your combs should be clean and wide bristled if you're having hair fall. And when you're drying your hair, I mean, make sure you don't do that towel drying and those kind of things. Then you sort of causing more friction. So you just let your hair just be gentle and wipe it, and then let your hair dry. So that's important. And don't tie wet hair. That's also very important.
I think we've been hearing these tips for a long time, but I don't think a lot of us actually use it. I think even I'm going to start using most of these tips now. So I think this brings us to the end of our chat here. Thank you so much, Jaishree.
Thank you. Thank you. Bye.
Great talking to you. Bye.
Bye.